A device that uses flashes of light to detect a byproduct of liver disease is being tested at UW-Medicine.
The purpose of the flicker device here is to enable us to provide patients with a tool that they can measure for themselves at home to see if they're at risk for developing hepatic encephalopathy. As a hepatologist, as a provider for patients with liver problems, we see patients with a condition called cirrhosis, and that's where someone has quite advanced liver disease. These patients with cirrhosis are at risk for a condition called hepatic encephalopathy, which is another word for liver-caused confusion. Basically, the liver is so sick that it's not clearing out the toxins in the bloodstream, and that leads to mental fogginess, confusion, can sometimes even be life-threatening and require a hospital stay to address. One of the challenges, one of the unmet needs for this condition is that we don't do a very good job and we don't really have many tools to screen for this condition at home.
This device was created through a collaboration with the University of Washington's Paul G. Allen School of Computer Science and Engineering.
So this is a Beacon device. It's used to administer what's called the critical flicker frequency test, which is basically the speed at which a flickering light would appear like it's not flickering to you. This is an app we built that connects to this device that we built. When I press start, it's going to start flickering really fast. It's going to be so fast that I can't see it flicker, you can't see it flicker. And it's going to get slower and slower. And then eventually, it's going to get to a point where I can't see it flicker, and I'll just press a button. And then it'll record that measurement, and that measurement is the indicator for hepatic encephalopathy. We do this process 8 times, and then it'll average it and then give me a number.
With results in hand, doctors could then use these readings as a stepping stone for earlier detection and care.
The critical flicker frequency as an objective test has been studied not just in patients with cirrhosis and hepatic encephalopathy. It's also been studied in patients who may be suffering from dementia or various diseases that affect the optic nerve. And what we hope to see is that the flicker device is also applicable in these other patient populations as well.